Like Dominic Hospital as secondary status under the National Health Insurance Scheme comes with responsibilities, challenges, increase in demands in terms of medical and paramedical human resources, as well the use of the best technology. We are asking for your prayer and support in this novel journey which we are ready to travel. Now is precisely the time when we must return to basis of healthcare, when we can pray to consecrate our life to the service of humanity. We lead towards the achievement of better healthcare to our clients. We have been running several programs, formats, policies, and guidelines, all in place and well-defined. But there is one assessment tool, very educative, demanding, and quite stressful to achieve their standards. That one plays an immense role in Dominic Hospital, helping in improving the quality, safety, and efficiency of our services. In fact, it's part of our today's success. I am talking about safe care. A healthcare standard policy running by Chad. The safe care standards are accredited by the International Society for Quality in Healthcare, External Evaluation Association, a global leader in quality improvement, and Dominic Hospital is one of the few facilities in compliance with the highest mark, now stand at level 4. This is a good news for all of us, and especially to our patients. Distinguished guests, ladies and gentlemen, I would like to thank our Almighty God for the protection, guidance, and strength. The Dominican sisters from Germany, and our German friends and partners who contributed towards Dominic Hospital growth. I do not lose sight of the enormous contribution and dedication of both the past and current staff, the past and current management members, our Lord Bishop, and the diocese for their guidance and support. And all that, in one way or other, has helped Dominic Hospital to become what is today. Thank you all for joining us today for this important event. May God bless you all. You are warmly welcome.
Oh, I wish you do it better. Thank you so much, Dr. Mighty Alfonso. Dr. Mighty is the medical director of this noble hospital.
Your Excellency, my Lord Bishop, Your Excellency, my Lord Bishop, Most Reverend Joseph Afrifa Jikum, Your Royal Highness, Anna Ajakwa, and by extension all the chiefs and Nananum here included, the Director of National Catholic Health Service, Mr. George Ajayi, the management of this great hospital, led by Reverend Father Dr. Abang, and Medical Director, and by extension of the management team members. The distinguished staff of St. Dominic Hospital, invited guests, the Honorable District Executive in absentia, duly recognized, around, the District Director of Health Service here in Kedet, invited guests, members of the media here in Kedet. Barely a year ago, precisely on 9th December, on a Thursday, 2021, we gathered here in celebration of the hospital's 60th anniversary celebration. On that special day, of all the speeches that we had, very inspirational, there was a specific episcopal decree by my Lord Bishop, Most Reverend Afrifa Jikum, to CHAG and all here in gathered, that the St. Dominic Hospital that has lived 60 years and virtually on the brink of pension deserves to be elevated and recognized as a secondary level hospital. Indeed, that was an episcopal decree, and the decree is not subject to any question or comment. Indeed, for CHAG, we felt that the bishop's direction and instruction to us was in perfect alignment with the Ministry of Health or the government's overall policy of ensuring that by 2030, within the ambit of universal health coverage roadmap, everyone living in Ghana, afar and near, will have access to the highest attainable quality of healthcare, irrespective of where the person lives. But for CHAG, the significance of this episcopal decree was in twofold. One, in 1967, a few very small, about 7 or 10 groups of hospitals gathered to form what we now know as the Christian Health Association of Ghana. Among the elite group that gathered was the St. Dominic Hospital. And therefore, St. Dominic Hospital is a pioneer facility for CHAG. It's a founding member of CHAG. A major shareholder with high voting rights. Within the entire country and among the CHAG network, it ranks number 3 as the highest performing facility in the country. My Lord Bishop, obviously, CHAG was very much obliged to ensure that the elevation of St. Dominic Hospital becomes a reality. And so we set off on a journey in collaboration with the hospital management team under the leadership of the distinguished administrator, Reverend Father Aban, Dr. Maiten, and all the other management team members. We needed to ensure that we fulfill all the regulatory compliance requirements that are needed to ensure our legitimate elevation. So the hospital fulfilled the Health Facility Regulatory Agency requirements of licensing to be elevated to secondary level. But after that, we needed, as a matter of urgency, my Lord Bishop, Nananom, distinguished members here in Gedet, I am pleased to announce that through hard work, determination, distinction, the elevation of this facility into a secondary level hospital is not only about name, it's not only about some reputational brand or incentive. it offers several advantages, which I would like to enumerate very few. One, it guarantees access to quality, affordable healthcare services to people around this environment, the Nchembo environment, and also all the other facilities within this geographic area. Number two, it is now a referral center for all the other primary care level facilities here, or district level facility here. This is the Reginal Hospital. By the new status, it is now a center of excellence and an environment for complex delivery of highly specialized health services. What it means is that by elevation of this hospital into a secondary level status, the hospital now has the capacity, the recognition to deliver general and specialized healthcare services from internal medicine, obstetrics and gynecology, pediatrics, dental services, gynecology, accident and emergency, dermatology, ophthalmology, and all the other specialized services that one could contemplate. Its wider scope of service delivery has now improved. Not only that, it also means that once you're elevated, the services of this facility will attract higher tariff. I believe that is very essential. Beyond the name, reputational incentive is also substance. What does it mean? But then what it also means is that this hospital has dual status. It means that you have the capacity, or you are expected to deliver all the primary care services and also receive referrals either within or without. My Lord Bishop, may I emphasize that this particular facility is strategically located. It intersects about 3 other regions: Central Region, Greater Accra, Ashanti region, and of course within Eastern region. With this elevation, at the same time, you heard the medical director mentioning safe care level 4. Now the highest attainable safe care quality standard is level 5, and few countries have set level 5. Now, concurrently, the St. Dominic Hospital, apart from being a secondary level hospital, is also a level 4. You may call it 4-star hospital. What it means that the place is a sanctuary of holistic healthcare of the highest attainable quality services that we can deliver. It has a capacity to boost internal medical tourism. Anyone arriving in the country will look for safe care level status of a facility to make informed choice of attending this facility. Within the entire country, the St. Dominic Hospital now joins the elite hospitals, probably less than 30 within the entire world, entire country, as a hospital with the highest attainable quality of care, with the capacity to self-correct, auto mechanism to correct any medical errors that could ever pop up. My Lord Bishop, we have a lot to celebrate. But as we legitimately relish in our elevation, there are also responsibilities. The elevation has a probationary period of 2 years. 2 years means that we have to sustain and maintain the quality standards, the regulatory requirements that enable us to climb up to this highest level. What means that within 2 years, the hospital is required to do 2 main things. One, to ensure that the specialist services that enable us to reach this height will be maintained, number 1. Number 2, it also means that the hospital is required to invest in continuous professional development. Human resources are indispensable. It is a criterion that cannot be dispensed with. I will urge the hospital to ensure that the banner, the historic banner that you've lifted now, would indeed brighten the environment that we are in, with sense of excitement, pleased, proud, privileged to be part of this historic creation, and in fulfillment of this hospital's vision to be a health service that is best in meeting patient needs and expectations. May I call upon our Lord Bishop, respectfully, to come over for us to give this monument, historic monument, to the Bishop as the owner. My Lord Bishop, on 9th December 2021, right here, you instructed us to do the needful. As part of our stewardship role, we have fulfilled the mission you gave us. I am pleased here today on behalf of the CHAG Board of Trustees and indeed the entire network of CHAG, together with the National Catholic Health Service, to present this certificate to you as a testament of our commitment to fulfilling Jesus Christ's healing ministry, now and forever. Amen.
Today marks yet another big milestone in the history of St. Dominic Hospital here in Akwatia, Akwatia. That tiny seed that was sown by the Dominican sisters from Speyer in Germany after their invitation by the then Bishop, Most Reverend Joseph Oliver Bowers, SPD, continues to blossom. We are all beneficiaries of the great sacrifices of these sisters who dedicated all they had to build up this hospital to serve the needs of the people here and even beyond. For the years that they served in building this facility, they demonstrated true commitment and dedication to the cause of the sick, the poor, and the needy. That is why I also want to use this opportunity to express my sincere thanks to Nananum, who offered them the initial building and the land which the hospital, the sisters developed with time for us to see what we are seeing today. Certainly, the vision of the Dominican sisters could not have yielded the needed fruits without the cooperation of all the staff and people of Boedua, Akwatia, and the surrounding towns and villages. With hard work and dedication, one can always achieve great things. For this reason, I want to thank all our benefactors, especially from Germany and our partners, who have supported the growth of this facility, and also those from Ghana. As a CHAG facility, I'm happy the director himself is here, who has just spoken and handed over this testimony. And also the director of the National Catholic Health Service, and all the past members of Parliament, the members of Parliament, the district chief executives, and the present one, the district health directorate, and the present district director of health. What we are witnessing today, even though with a short ceremony, is so important and relevant for the hospital. Indeed, the executive director for health for CHAG has explained and said everything, and I need not to go into it. Indeed, we have waited for this announcement for some time now, and I'm happy he said that I gave a decree. Well, thank God that this decree really worked. I'm therefore very grateful to the National Health Insurance Scheme, who also worked so tirelessly and made all the necessary suggestions for us to qualify for the credentialing of St. Dominic Hospital to the second level. The invaluable role of CHAG, the National Catholic Health Service, and all who work behind the scenes in making the needed recommendations for the grant of the secondary status is highly acknowledged by me. Since I am not a clinical person, I will leave said details to the professionals to delve into this. To the medical director, the hospital administrator, and all the medical team, the staff, and all, I say thank you and keep up the good working spirit at this level. And you should not also, this should not be our last stop, as it has already been mentioned to us. Going higher, getting to this status means also a lot of responsibilities and commitment, and especially when it comes to patient care. This, for me, is a real Christmas good news for St. Dominic Hospital and a very wonderful Christmas gift to all of us, and for which I say congratulations, and let us all have the sky as our limit. Thank you.
The hospital administrator, Dr. Aban. Oh, let's do it again. Let's do it again. Okay, so the choir gives us.
My Lord Bishop, Monsignors here present, my brother, the Executive Director of CHAG, Dr. Peter Ebua, Nana Gudiahini and Nananom gathered here, the DC of the Nchembuo Municipal Assembly, the District State Health Director of Health, Tenchembuo, Reverend Fathers and Sisters, my very good friend and brother, Reverend Father Dr. Ebenezer Abam, management and staff of St. Dominic Hospital, management and staff of sister institutions. I can see Agomenya is here, Kufuridia and Nkoko. I believe others are here as well. We recognize you, members of the press, ladies and gentlemen. Thank you once again for the opportunity to be part of this happy moment in the life of St. Dominic Hospital. I thank the management and the diocese for this opportunity, and I remain grateful because I was once a staff in this hospital, and I can see some of the old staff, in the choir and among those who are seated. So I feel very much at home. We have said a lot. We have praised the hospital and the good things they have done over the years. It is good because a level 4 safe care facility and a secondary level certainly brings you into the fore of the elitist hospitals, as my brother Peter said, and therefore you provide a cocktail of specialized services. So it is a reason why you become a referral facility. So for bringing you this far, I would like to thank the management and staff, the Ghana Health Service in the region, and the diocese for how far we have developed this hospital that was started by the Dominican sisters, as my Lord Bishop just said. So the real work starts now to maintain this enviable status that we have achieved today. So every manager, every supervisor, every member of staff have a duty here. Please work professionally and do what is expected of you if you cannot do more. So all of us, the stakeholders, the diocese, the Ghana Health Service, CHAG, the Municipal Assembly, donors, Nananum community, everyone, the church, let us also commit to support the work St. Dominic does in this facility. While congratulating management and staff on these achievements, on behalf of the entire National Catholic Health Service, my message is simple. Review systems and processes of care, and do not hesitate to introduce the necessary changes where it is called for. Again, do not forget to implore the support and expertise of the staff, because management may not know everything. Let us consult and let us do it together. And in case there's any staff who is standing in the way of delivering quality healthcare services, please dispense with his or her services. We will support you on this course. I know that you excel among the secondary and level 4 facilities across the country, because I know excellence is in the DNA of St. Dominic Hospital. Long live St. Dominic Hospital. I thank you very much.
I am full of excitement and I'm vibrating with a sense of accomplishment and satisfaction for the feat achieved together as a team. I wish to put on record that the elevation of St. Dominic Hospital from primary to a secondary level hospital and achieving the level 4 of safe care assessment have been made possible due to the hard work, commitment, duty, and dedication to assigned task by all the members of the St. Dominic family. That is the hospital management team, the general staff population, and all our external stakeholders. Please, let us give ourselves a round of applause for achieving this feat. We have done so well and indeed deserve to be proud of ourselves. I echo to all of us. I cannot but to pay glowing tribute to our forebears for all the fundamental works they executed. Of special mentioning here is the Dominican Sisters of Spire for their pioneering and exemplary roles towards this direction. Records of the hospital available indicate that the agenda to be accredited a secondary facility started in 2008. In September 2017, having taken over the administration of the hospital, this agenda was earmarked an indispensable project for the new hospital administration team, management team. Therefore, in the 10 years, 2018 to 2022 strategic plan of the hospital, every step towards the achievement of this feat is highly approximated and flagged for necessary actions. Your Excellencies, I wish to state that since 2018, every step on the way in the administration of this hospital has had its focus on the attainment of credentialing as a secondary level hospital. In 2019, the Health Facilities Regulatory Agency, HEFRA, having assessed the hospital, accredited it a secondary level facility. However, the hospital would not meet the checklist of the NHIS assessment tool. I must be quick to add, though, that this was good omen for management of the hospital since loopholes were identified and necessary works were earmarked to satisfy the same for future assessment. Subsequently, a 10-step strategic points were earmarked thereof as follows. Agenda data-driven one-stop shop, total automation of services and payment systems and strengthening of internal control systems. 2, restructuring of consulting rooms, facelift of the OPD and creation of OPD at Children's Ward. 3, massive investment in the procurement of medical equipment and tools, as well as operation at least 97% medicine availability at all times. 4, restructuring of the main hospital entrance, renovation of the main pharmacy department and the maternity ward, creation of delivery suites and theater within, relocation of the ANC unit closer to the maternity block, and start of the lifestyle clinic at the previous ANC site, as well as creation of the palliative care unit. 5, relocation and construction of new laboratory department and restructuring of the casualty unit to ultra-modern accident and emergency department, creation of an ICU at the main theater department. 6, reconstruction of the former laboratory department into radiology department with CT scan on board, and upgrade of the centralized oxygen system from 60 liters per minute to 150 liters per minute with the help of our German partners. 7, expansion of the lifestyle clinic to include wellness center, ENT clinic, mental health unit, cervical cancer unit, and enclosure of the whole clinic. 8, creation of the stroke unit and re-equipping of the ICU and the accident and emergency department. 9, extensive maintenance works on all the inpatient wards, converting the palliative care unit into COVID-19 high dependency unit through CHAG in collaboration with the UK aid. And 10, renovation of the sanitary facilities of the male and maternity wards, as well as construction of 4 additional private wards within the existing wards. Your Excellencies, I wish to report that the occasion we celebrate today has been made possible largely because of the successful execution of these 10-step strategic points enumerated above. Your Excellencies, just when preparations were afoot for this celebration, on Monday, 12 December 2022, as has been said earlier on, we received an official report from Safe Care for the assessment they carried out on 19th September 2022 here at St. Dominic Hospital. They scored the hospital 70%, which results in a level 4 certificate. This means that by international standards, we've been hearing Safe Care 4. just for us to understand that by international standard, in accordance with Safe Care Stepwise Quality Improvement Program, to ensure the delivery of safe and quality, secure care to patients, St. Dominic Hospital is left with only one step to reach the peak, step 5. There cannot be any better place to receive health care than St. Dominic Hospital. Thus, when you are sick and visit this hospital, the quality of care you receive, according to Safe Care standards, is just as having visited any high-profile hospital anywhere in the world. That has level 4. And we should indeed be proud of this. Indeed, there is every reason to celebrate the goodness of God, and as your leader in these strategic wins, and we can't wish this off. I also would like to mention, and these people, if they are here, they should fall forward for me. Mr. Dennis Kofi, internal auditor, is he here? Fall forward for me. Mr. Joseph Adams, our clinical supervisor and risk manager, please fall forward for me. Mrs. Evelyn Tachi Benson, aka Evelyn Amoako, fall forward for me. Mr. Emmanuel Dogre, is he here? HR manager. Mr. Richard Aholu, head of finance, acting CA, please come forward. Mrs. Susie Efua Kabe, chief pharmacist. Mr. Hifford Asari Williams, Deputy Hospital Administrator. Monsignor Paul Abankwa, Financial Controller. Mrs. Anita Oseitufo, Head of Nursing Services. Dr. Mighty Alfonso Romero, Medical Director. Please fall forward for me. I want you to clap for ourselves and these men and women. Thank you so much for all we have done together as a team. God bless you. Thank you. Please resume your seat. I mentioned them not for any other reason, but because specific assignments were given to them, and as the ED of CHAG announced, they didn't have any problem with us. It's all because some people were working and they executed their assigned mandate so beautifully. At this juncture, may I declare my loudest signature phrase on teamwork once more. My dear friends, let us always remember that together as a team, the roads are divided to double the successes. Together as a team, it is just a matter of dividing the roles, but always think about what comes thereof. Successes are doubled. May we forge ahead ever more resolved in a united band. God is not done with us yet. We shall live to tell more success stories to the glory of God. On this point, I wish on behalf of management and staff to sincerely express the heartfelt appreciations of St. Dominic Hospital to all who in diverse ways contributed to the achievement of these great successes. Without mentioning any particular person, but the Executive Director of CHAG, Dr. Peter Yebua, for the singular lead role in this remarkable achievement. Chief, thank you very much. And on this note, I please request you to step forward. Everybody, please join me. So St. Dominic Hospital today confers on you as our special friend and partner with the special pin designed and designated to Dr. Peter Yebua. Thank you, Doctor. Let us clap for Dr. Yeboah. Doctor deserves it. Thank you. We are very grateful. We are very grateful. To you, one and all, we are deeply grateful, and may God bless us all. Thank you very much.
Assalamu alaikum. Amen. Assalamu alaikum. Amen. Salam alaikum. Salam alaikum. Assalamu alaikum. Amen. Assalamu alaikum. Amen. Salam alaikum. Salam alaikum. Salam alaikum. Salam.